Welcome back. We're in the midst of spring and it's likely travel is on your mind, but do you really know what to pack to protect yourself at your destination? Tonight we're talking about a global health threat the CDC is warning travelers about. Our national health correspondent Monica Robbins talks with one of our medical experts for advice we all need to know.
If you're getting ready for spring break or even planning ahead for a summer vacation, you're likely packing the sunscreen and bathing suit, but depending where you're going, make sure you're aware of any potential health risks in the region. And some of them may feel like they're coming out of history books. Dr. Jen Cottle is a family medicine physician and associate professor at Rowan University and always has some great advice. So Dr. Cottle, thank you so much for being here. How does one get dengue fever and what makes it so dangerous?
It's a viral infection and the virus is actually spread by mosquitoes. But the symptoms really can range. I mean, they can be sort of on the milder side, fever, nausea, headache, things like that. The thing we worry about is it's turning into something really more severe. We call this a hemorrhagic fever, where there's bleeding, a shock, organ failure, etc. So you can see it actually can become very severe, and it can become very severe very quickly.
So what do you need to do before and during a trip to protect yourself?
Go to the CDC website to take a look at where they're traveling to. The CDC will be able to give you some updates on if there are certain diseases circulating. The best thing to do is to make sure you pack that mosquito repellent. We're talking an EPA, that's Environmental Protection Agency approved mosquito repellent, one with, like, say, an active ingredient like DEET. But you really want to make sure you're bringing your bug spray and that you're keeping yourself covered. You're not sleeping out in the open. You got mosquito nets, using air conditioning. I'm also still traveling wearing a mask. You want to be very cautious and careful, and just be careful, because there's a lot of bugs running around out there.
Great advice. Thank you so much for everything you tell us and your insight.
Thank you.
All right, I'm Monica Robbins. Back to you all in the studio.